South Carolina Senator Tim Scott is calling on the Trump administration to monitor the impact of the coronavirus on communities of color. He is also the author of the new book, Opportunity Knocks, which chronicles his childhood struggles in poverty and shows us how we can use small failures as teaching tools. First on CBS This Morning, Senator Scott joins us from outside Charleston. Senator, good morning. Thanks so much for being with us.
Good morning. It's good to be with you. Hope you're well.
I want to get to the book in a moment, but first, as we mentioned, you've spoken directly with the administration about the need for better outreach with minority communities about the coronavirus. What exactly would you like to see happen there?
I think it's really important for us to use all resources at our disposal to make sure that churches, small businesses, community centers are all engaged in this fight to reduce the spread of the coronavirus across America, certainly, specifically in the African-American community. African-Americans represent about 1/3 of all hospitalizations, but only about 13% of the nation's population. And you'll find on most of the front lines in the grocery stores, some of the takeout services, you'll see a lot of African Americans working. And so what we want to make sure that we understand is if you have a higher incidence of high blood pressure and asthma, it's really important for you to take the necessary precautions from wearing masks, washing hands, all the protocols. But this is uniquely and specifically targeting the African American community with a strategy to make sure that we are fully prepared and undertaking those protocols that will save more lives than we have today. Because what we're seeing in states like South Carolina, 36%, 37% of those folks infected with the coronavirus, with a population of only 27%. In Michigan, 41% of the fatalities, 14% of the population. In Louisiana, 70% of the fatalities, and only less than 30% of the population or thereabout. Mississippi, over half of those infected, and about 31% of the population thereabout. So we're seeing a higher incidence, and I think we can reduce that or flatten the curve in the African American community, and it will help the nation as a whole.
Only a handful of states actually collect data on these racial disparities. What do you think a federal tracking system might do to help doctors?
Well, aggregating the information from the federal level will be very helpful. We're doing it in South Carolina. I spoke with my governor. He's on the game. He's on spot. The data would help us to provide the type of information so that our healthcare workers are as protected as possible. My mother spent over 45 years as a nurse's aide in a hospital. So making sure that the frontline folks are taken care of is really important. One of the challenges that we have going forward is if we don't reduce the incidence of COVID-19 among our healthcare workers, then who's going to take care of us? So the most important thing we can do is protect that front line by putting a shield between them and their patients. The fastest way to do that is to have fewer patients. The way you do that is by following the protocols, and the masks are very important. I talked to Dr. Fauci about that specifically a couple of weeks ago, and he said, without question, masks help you not spread to your loved ones. So when you're talking with your grandmother or when you're visiting your father, it helps.
Senator, we're all getting the message about the mask. I think so. The president is now pushing to reopen the country by May 1st. Good morning. Good to see you. The president, as you know, is pushing to reopen the country on May 1st. Dr. Fauci has said, listen, we're on the virus's timeline, not the other way around. And it seems like health experts don't believe that this is the right move. I'm wondering what you're seeing in your state of South Carolina. Does it seem like the right move to you to open May 1st?
Well, what I've seen is a lot of flexibility from the administration as it relates to what that date was. The date was April 15th, but the experts said that was premature. We saw it kick to April 30th, and as the information continues to be collected, I think you'll see perhaps another shift if necessary. In South Carolina, we've had around 80 deaths, 2,500 plus infections. So I think we are handling it pretty well. We have some hot spots that we're concerned with, but here's what we have to do. The containment strategy was effective. The mitigation strategy is now flattening the curve. But for us to go back to work and for parents to send their kids back to schools, we're going to need an abundance of testing. The finger prick test, in my opinion, is what we should be focused on, is making sure that we know who's had it and also being able to have tests on demand. As we enter into that market, you'll see more energy towards opening this country's economy back up. But without that kind of certainty, I think everyone's going to be challenged as we head into the end of April, saying what we should do without an abundance of testing, especially the test that tells us who's had it.
Senator, in your book, you write about growing up in poverty and your journey to becoming a senator. What advice would you have for anybody right now, for anyone who's struggling out there?
You know, hope springs eternal. One of the lessons of the book that you'll learn in Opportunity Knocks is I've had healthcare challenges. I've unfortunately fell asleep driving a car down the interstate at 70 miles an hour and went through the windshield, broke my ankle, ruined my senior football season. But I found faith as a result of that. I failed in business, and then I found success after that. I've lost campaigns, but even in the aftermath of the campaign losses, opportunity knocked again, and I had an opportunity to get back in politics and to finally become a United States Senate. I have had failure, and it always seems that there's a silver lining, that success follows failure like night follows day. It's been a blessing, and I hope my story provides hope during these challenging times, because the one thing I'm completely confident of is the best is yet to come for this nation, and for most of us in this nation. We have very bright futures to look forward to.
I hope we do. Senator Scott, thank you so much. Opportunity Knocks is on sale tomorrow.